Before we start, we want to health to COVID-19 protocols such as wearing our mask and then applying alcohol to our hands. So when that's done, we can now begin with our treatment session. So hi sir, my name is Ethan Benaventuro, I'll be your physical therapist for today. So how are you? Okay sir, so before we start, sir, may I ask your name and your date of birth for verification purposes. Okay, thank you for that sir. So sir, it says here in your chart that you have a limitation of motion of your right shoulder towards moving it outward and inward, sir. Would that be correct? And then it says here, sir, it has been tested it's 0 to 20 degrees, sir. Is that right? Okay. And then, sir, for the pain rating, sir, you said it's 6 out of 10, sir. Is that correct? Okay, sir. So, don't be, for the normal range of motion diya sa atong shoulder, sir, okay, for the outward movement is 0 to 90 and for the inward movement is 0 to 70. So, dako gyud ang limitation of motion, sir, but don't worry because we'll be addressing that in our treatment session today. So, for our treatment session today, sir, we'll be doing a peripheral joint mobilization technique, sir, and this technique would help in increasing range of motion and as well as addressing the pain that you're feeling, sir, because it will help separate the joint, sir, that is adhesive, sir, to each other. So, at the later part of this assessment, sir, it will require me to come into contact with you. Would that be okay? Okay, sir. So, before we begin, sir, kay ask ako, sir, do you have any swelling, sir? Wala, sir? Any bone abnormality, sir, or bone disorder, sir? Wala, sir? Any joint effusion, sir? Wala? Any hypermobile joint, sir? Wala, sir? Okay, that's good, sir. So before we start, sir, we'll be taking your vital signs, sir. So, we'll be taking this kanang blood pressure using this sphygmomanometer and as well as this stethoscope, your pulse rate, your respiratory rate, and as well as your temperature for using a thermometer, sir. So assuming that all of these are within normal ranges, we can now begin with our treatment session. So, sir, at this treatment session, sir, it would require me to change your position, sir. Will that be okay? Okay, sir. So I want you to lie on your back now, sir. Okay, sir. So first, sir, we'll be applying glenohumeral posterior na kuan, sir. Posterior resting position na kanang technique, sir. So what I'll be doing, sir, is I'll be using my trunk to stabilize your arm, sir, and using my hand on the outer part of your arm, sir. So this position would help. I would apply a grade 1 distraction test, grade 1 distraction, which would help in addressing the pain of the patient, decrease the pain of the patient. So for my arm, and for my other hand, I will put it on the distal part of the joint of the patient, and as well as my other fingers would be on the superior part of the patient. So for the oscillations, we'll be using a grade 3 oscillation because this would help increase the range of motion. Okay. So for the grade 3 oscillations, it would help increase range of motion, and for doing it, we have to go to the end range, the kaya ni patient, and then mid-range, and range, mid-range, and range, mid-range, and range, mid-range. So for that, we'll be aiming for 2 to 3 oscillations per second with 3 to 4 seconds rest in between oscillations. Okay, so assuming that the test is done, so sir, for the other part of this test, sir, to address your external rotation, sir. Yes, sir. So that's for your external rotation, sir. Okay, we'll be doing glenohumeral anterior glide on a resting position, sir. So I'll be changing the position, sir, into prone. Hey, on your I want to change the position, sir. Will that be okay? Okay, so I want you to lie on your stomach, sir, huh? Okay. So the patient is lying on his stomach already. So I'll be inserting a towel here near the shoulder for the stabilization, for help of stabilization. So for this, I'll be using my thigh to stabilize the arm, and then I'll be using my other hand away from the body of the patient to stabilize the arm. This would provide another grade 1 distraction, should help address the pain of the patient. For my other arm, I will put it from the pizarist area or the ulnar head onto the distal part of the joint, and then as well as my fingers will be on the superior part of the shoulder. So we'll be doing the test na, sir, ha? I will be doing the technique na, sir, ha? So for this, again, it's for grade 3 oscillation, because for grade 3 oscillation, it would affect the range of motion of the patient, and then we're doing it 2 to 3 times per second, as well as a 3 to 4 second rest in between. So end range, mid range, end range, mid range, end range, mid range. So once that's done, assuming that the test is done, sir, you can now go back to your sitting position. Okay, sir. So before we end our treatment session, sir, okay, we'll be checking your range of motion again, sir, ha? So, sir, I want you to move your elbow up, sir, and then your arm forward lang naman, forearm forward lang, sir, ha? So, at the count of 3, sir, I want you to raise your forearm upward, sir. 1, 2, 3. Okay, whatever ka feel of pain, sir. Okay, that's good. So, sir, balik sa normal, sir. So, I want you to point your forearm downwards, sir, ha? So, 1, 2, 3. Whatever ka feel of pain, sir. Okay, that's good, sir. So, sir, so for the capsular pattern, the eye of the shoulder, it's the external rotation is greater than abduction, and abduction is greater than internal rotation. And for the resting position, it would be to 70% or 70% scapation of the patient, which is kanang in between horizontal abduction and as well as flexion. Okay, so before we end, sir, so after that, sir, before we end, we have to take your vital signs again. And then assuming that all of these are within normal ranges, okay, sir, thank you for coming to our treatment session, and I hope to see you in our treatment section next time, sir. So take safe, sir, and God bless.